Okay, hello everybody. I am going to take you through ABG Analysis, and I want you to just listen to the concepts and what I take you through, and then I'm going to show you some tricks for memorizing if you want to do that. So I use a step-by-step analysis. I just look at one parameter, then the next, and then I make my decisions, and I don't try to mix those together. I do it one at a time, so I'm going to show you that process. First of all, when we get our arterial blood gases, ABGs, recall that we'll see a pH number at 7.35 to 7.45. That's the narrow range that the body needs to keep the amount of acid and base within for us to not have symptoms and to have a disorder. So that's our normal pH. Our normal PaCO2, so we have a P in front of our CO2. CO2 is respiratory. So I retain or blow off CO2 based on my breathing rate. Respiratory is CO2. The CO2 is my acid. A normal PaCO2 is 35 to 45. The next parameter is my bicarb, my HCO3. My bicarb is my metabolic component. Bicarb is made and retained or excreted by the kidneys. It takes longer to be produced and to be managed to change the pH than our breathing. So we can breathe faster or breathe slower, quicker, obviously, than we can make new bicarb and retain that or excrete that. This is my metabolic component. It's my base. Okay, the normal range is 22 to 26. So then, remembering this, the first step I take when I get an ABG back is to look at my pH. So always start with your pH, and you're going to define what it means. So if I'm between 7.35 and 7.45, I have a normal pH. If I am less than 7.35, I have acidosis. That's my acidotic side. Okay, and if I am greater than 7.45, I have alkalosis. So less than 7.35, I have too much acid or not enough base. Greater than 7.45, I have too much base or not enough acid. Okay, so start with that. All right, then your PaCO2, remember that this is your acid and it's respiratory. If I have less acid, so less than 35, that's not a very good 3, less than 35, I don't have enough acid, so I have a low amount of acid. That means that I have too much base, low acid, that I'm going to be in alkalosis if the PaCO2 is the cause. Okay, so when we look at a high greater than 45, that means I have too much acid, I'm retaining CO2, and that means I'm going to be acidotic if this is the cause. Okay, when you look at that, recall that if your PaCO2 is less than 35, it means that you're blowing off CO2, you're hyperventilating. So this is my hyperventilating side. If I have greater than 45 as my PaCO2, I'm retaining acid, retaining the CO2. That means I'm hypoventilating. So my respiratory rate's less than 10 here, or less than 12 possibly, and when I'm hyperventilating, it's greater than 20 and usually significantly greater. Okay, then let's look at our bicarb. If my bicarb is less than 22, it means I don't have enough base, so I don't have enough bicarb. That would match acidosis if it's the cause. If it's greater than 26, it means that I'm making and retaining extra base, or I've gotten a base load from something, and that means if this is the cause, I have alkalosis. So it's very important for you to do it methodically. Start with your pH, identify which disorder you're in, then look at each parameter in however they're listed on your ABG slip, and decide, does the PaCO2 match your disorder, and if so, we'll talk about how to record that. So let's start with an example. We'll start with a simple example. We're going to have a 7.2 pH. Okay, so my 7.2 when I look at my chart is less than 7.35. That means I'm in acidosis. So the first thing I do then is write the word acidosis down. The pH is always right. So the pH will tell you if you're acidotic, normal, or alkalotic. Okay, then I'm going to look at my PaCO2, and it happens to be 50. I'm going to look at my bicarb, and it happens to be 24. Okay, now I'm going to evaluate each parameter one at a time. When I look at my PaCO2, it's 50. It's higher than 45. It's my acid. It means I'm retaining CO2 or acid. It means I'm hypoventilating. It matches my pH. So it's acidotic. I'm in acidosis. This matches my pH. So I'm going to write down in front of acidosis respiratory. So my patient's in respiratory acidosis. Then I'm going to look at my bicarb level. I look over here, I see it's right in the middle of the normal range. My patient has a 24. I call this then uncompensated respiratory acidosis. It's uncompensated because the bicarb is normal. It doesn't match the pH, so it's not the cause. It's not moving out of range to try to help correct this respiratory acidosis. So I'm in uncompensated respiratory acidosis. Okay, those are fairly straightforward. One of your parameters stays in range. One is out of range. It matches your pH. You name it, the one that's out of range, plus acidosis or alkalosis. So let's look at that again. Let's have a pH this time of 7.6. Oh my, let's not have it that high. They could be dead. Okay, 7.5, that will be better. We have a PaCO2 then of 36, and I have a bicarb level of 36. Okay, so those are the ABGs I got back. I start by ignoring those two. I look at my pH and I say it's 7.5. It's above the 7.45. It's on my base end, so I write down alkalosis right over here before I even look at anything else. Then I methodically go to my next step. I look at my PaCO2. I see that it's normal. It's in range. So it's not causing or compensating. It's normal. I look at my bicarb. It is well above the 26. It's on the base side. I am retaining too much base. That's my metabolic parameter. I'm in metabolic alkalosis that's uncompensated. Okay, when you feel like you've mastered this step, so just make up some numbers, try to keep one of your parameters in range, and practice that. Now we're going to look at what it means by partial and full compensation. Okay, we're going to start with partial compensation. In this case, my pH is 7.23. My PaCO2 is 32. And my bicarb is 18. Okay, so let's look at our parameters. Our pH is 7.23. I look over here and that's less than 7.35. So that's my acid side. I'm going to write down acidosis before I look ahead. I know my patient is in acidosis. Okay, then I look at my PaCO2. It is out of range, but when I look at it, it's on the low end of the 35. That means I have less acid, less CO2 than normal. I'm hyperventilating. I'm blowing acid off. So that does not match my pH. If this was causing this disorder, this would show alkalosis. So again, I'm blowing off, getting rid of acid. This does not match. It's not acidotic, so I have to look at my bicarb. My bicarb is 18. I look back over here and I see that's less than 22. That matches my pH because I don't have enough base in my body, so I'm in metabolic acidosis. I'm going to write that down. And I look back now at my PaCO2 and say to myself, this does not match the pH, but it is causing me to gain some base and lose some acid through blowing off that extra CO2 or my acid, and it's helping me to compensate for this acidosis. So I'm in partially compensated metabolic acidosis. Note that on the board. All right. These are probably the hardest for students, and we will do lots of practice questions. You have 50 practice questions of ABGs that are in your packet, and you can use those to work on this once we're finished. So again, I have a pH that's out of range. It's acidosis. I wrote that down. My PaCO2 is low, which does not match my pH. In fact, it's going the opposite way. So then I go down to my bicarb because I want to see my cause of the pH, and I see that my bicarb is low. It's less than 22. It means I don't have enough base. So I'm in metabolic acidosis. I look back at my PaCO2 and say, nope, it's not normal. So I'm not in uncompensated. Rather, it is blowing off acid so that I'm gaining additional base through that, and I'm in partially compensated metabolic acidosis. It's only partial compensation because my pH remains out of range. Okay, so we've done uncompensated, partially compensated, and now I want to do fully compensated. And this is the one also that students have a little bit of trouble with, but let's just try to talk this out. So my pH for this patient is 7.35. My PaCO2 is 70, and my bicarb is 48. This is a classic ABG for a patient with chronic obstructive lung disease. So you recall that they are CO2 retainers. They hypoventilate on a daily basis, and they're used to that, and they've made adjustments to that in their body. So let's look at their pH. If you were going to write down acidosis or alkalosis, you couldn't because they're in normal range. But I want you to look at the number, and I want you to write down, after you look at these and say, wow, they're both out of range. The PaCO2 is high. I'm looking at my bicarb, and it's high. They're both out of range. So I don't have normal ABGs. If I had normal ABGs, these all three would be in range. So I'd have a 7.35, maybe 45, and maybe a 23. Okay, so they'd be totally normal. I look at this and say, these are both abnormal, they're out of range, and that one's normal. So I want you, when you see that, the first thing I want you to do is look down and say, which is it closer to being? Is it closer to acidosis or is it closer to alkalosis? And it's closer to acidosis, so we're going to write that down, have that written on our board. Then we're going to look at the PaCO2. So if this was truly an acidotic pH or closest to acidosis, does my PaCO2 match that? I look over and I see it's greater than 45. It does match it because I am hypoventilating and I'm retaining CO2. So yes, this is elevated and it matches. So I'm going to put down respiratory acidosis. Then I look at my bicarb. Does this match my pH? 48 is greater than 26, so I have additional base. It does not match my pH. It's going the opposite way. So you can see it's also an elevated value, but this is my base. So I have too much acid and I have too much base, and together they're working. This is working to correct the cause of my pH, and it's giving me fully compensated respiratory acidosis. And many of our COPD patients, again, will walk around with ABGs like this each day. So they have hypoventilated over a long period of time. Their body has gotten the picture that they are not going to breathe off their CO2 because their lungs are damaged. So the kidney has decided to make all the bicarb it can, usually takes 2 to 3 days, and it's going to keep every molecule of bicarb it can find. So what happens then is the patient does fine because he actually has a normal pH. pH, even though he's breathing less times a minute than he should, because his kidneys have had time to adjust, and over time they continue to make and retain bicarb and allow him to have a normal pH. This changes, of course, if he has an acute pneumonia, and then we can have out of range pHs. So I would like you to practice each of these examples, and we'll talk about them more in class, of course, and go back through that. And come back and look at this if you need to. Ask me if you have any questions at all, if you're practicing. I just want to finish by saying one more thing. When you had your PN year, if you came to NCC, Judy had a box that she used that helped you to memorize this content. Again, I just go through my steps, and so I don't have a box or a cue card like that. There's also something called ROAM that you can use, and I'll just quickly explain that. So ROAM stands for Respiratory Opposite Metabolic Equivalent. So the first thing we have to do is identify our pH. And for here, example, is if my pH is low, obviously I'm in acidosis. This is opposite. So if the respiratory is the cause, if my PaCO2 is the cause of the acidosis, I have a high PaCO2. So they're opposite arrows. So low pH, high PaCO2. The same would be true if I had a high pH, I'd be in alkalosis. And then my PaCO2 will be low. So I'll have a low PaCO2. So respiratory opposite, and that should make sense to us. If I'm below 35, I'm blowing off my acid or CO2, and I become alkalotic if that's the cause. Metabolic equivalent, so if I have a low pH, I'm acidotic. And also, metabolic, remember, is my base, it's my bicarb. The arrow goes the same way, so I have a low HCO3, I have a low bicarb. Over here, if I have a high pH, I would have alkalosis, and my bicarb will also be high. So since we've learned about compensation today, again, I want you to know, and I want to stress, this is the primary disorder. So the pH and the respiratory or metabolic match your pH. So they're the ones that are causing it. So if this helps you, you should use that. If it doesn't help you, at the very least, you have to memorize this information and make sense of if this is below 35, what it means to your CO2. It means you don't have enough acid, you've blown it off, you've hyperventilated. If it's above 45, you have too much acid, you're hypoventilating and retaining it. If you have bicarb that's less than 22, you don't have enough base. That's the metabolic component. That means that you'll be in acidosis. If you have too much, it'll be above 26. You have too much base, you'll be in metabolic alkalosis if that's the cause. Thank you.